right now there's the WISeR model that was released from the Center of Medicare and Medicaid Innovation. And what they've basically done is said, hey, we've identified therapies that we think might have a high level of fraud, waste, and abuse, and we are going to require, for the next 6 years, prior authorization for those therapies in a certain number of states. And so it's a pilot program. And what that means to me when I see that is this is Medicare's kind of sticking their toe into prior authorization, like utilization review, which is one of the biggest issues we see with private payers at the moment.
It's worse than that.
Well, and just for people who are listening, right? So when anybody who's needed a surgery, you'll hear their doctor tell you, I've got to get your insurance to authorize this. And if the insurance doesn't authorize it, you have a really big problem, right? And the amount of work to try to get that approved is exponential, right? And one of the value propositions of traditional Medicare has always been, since the 60s when it was implemented, is we will not do prior authorization and we'll pay you quickly, right? Which was part of the whole thing. That was to get physicians into the Medicare program. Now you see the writing on the wall. It's very obvious to me that that's what they're doing. And purely, I'll say this, and anybody that's listening, my frustration acutely is they've named therapies in general, right, that they are going to implement prior authorization starting January 1 of 2026, which is less than 3 months away, but they have not yet identified the actual CPT codes. So all of us who are launching therapies in this country, we're less than 90 days away, and we don't know if Medicare is going to require prior authorization in those states for those particular therapies on a CPT code basis, which I can tell you, as we try to raise money in this country, that's the first thing investors are saying. Well, is that going to require prior authorization by Medicare? And let me tell you, Medicare is the 800-pound gorilla. If you've got a problem with Medicare, you got a problem, right? I equate this to the IRS. If you have a tax problem with the IRS, you got a problem, right?
Well, and if I understand what they've proposed in the WISeR model, it's not just a prior authorization model. It's an after-the-fact model. That is, they will look at what they deem as low-value care and come after the fact and say, we've identified these procedures or this care that you've rendered that we don't think should have been given in the first place, and we're gonna take the money back.
One of the things that it says in there is if you choose not to get your procedure prior authorized, then you are subject to post-payment review.
Post-payment review. Yes.
Right. And it really becomes post-procedure review before they pay you, right? And so now you're in a worse situation because now the patient's already got it. You've expended all of this money and time to provide the patient a therapy that all the other states can do, not a problem. And there was no public comment to any of this. It just happened.
But there's two things we need to talk about here. We need to talk about WISeR itself, but we also need to talk about this so-called innovation center that was part of Obamacare, CMMI.
So just to be clear, so CMMI was created as a function through Obamacare.
It's a budget gimmick. It was a budget gimmick